what's the difference between what VRBO websites put out there and what conventional physical therapy websites put out there? And if you were a patient, what would be your thought when you get there? So we've got a bunch of conventional PT clinics in Loveland where I'm at, and we've got one that they are the masters of the VRBO bait and switch thing. So they sell themselves as these, one-on-one with your therapist, and we do everything. They do. They're certified in everything. Anything that comes out, they were the first ones to be certified in cupping, first ones needling, first ones K-tape, first ones laser, all the garbage. They're the first ones to get certified. They've got like 5 PTs that work there. I think a couple PTAs, something like that. And they sell themselves they take lunch constantly to doctors. So doctors think they're phenomenal. Oh, they're certified and blah, 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 blah. Yeah, I know they're certified and blah, 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 blah. And if you look on their website, they're like eye contact, smiling at their patients and having a great time in PT, doing rehab, manual therapy. They're all certified in some kind of manual therapy crap. So when you actually see this clinic, the clinic their treatment room is probably maybe even smaller than mine. On a busy day, we have three PTs in there. They have like 6 jammed in there and just equipment all over the damn place. So the funny thing is when people come to see us after they see them because they don't get any better, they always have a little blue folder. And their blue folder has, the buy-in graphics and, here's the triangle of recovery. And at the base, the first 3 visits, we're going to work on controlling your pain. And then we're going to do this and we're going to do that. And here's your journey. And let's put a calendar with all of your appointments. So they put like a 4-month calendar. And then here's your appointments for 2 to 3 times a week for the next 8 weeks, whatever it is. So when patients come in, they bring their little folder and they have all their handouts, their exercise, their correctives and all that crap. And so I'm looking at this, and one lady came in this week. She's a Medicare, and she had the handouts for laser, and Medicare doesn't pay for laser. Thank you, Medicare, for not doing that. So they had to pay $60 per visit for the laser, and it's describing what the laser does. And it says, you might get up to 12 hours of pain relief with this laser. So basically they're telling you, you're not going to get any better. We might get you to feel better for $60, but you're not going to get any better. Keep on coming back though. Keep on doing it. Absolutely ridiculous. So as I go through this lady's thing, and she's telling me about how she went there 2 times a week for 6 weeks and didn't get any better. And she's coming in to see us for scoliosis. So doctor's referral is for scoliosis. She's got a tremendous structural scoliosis, but she functions like crazy. She can squat, she can bend over, twist, do single leg squat, all that kind of stuff. Her problem is when she gets to the single leg squat, she's got lower extremity weakness. So she can't do a single leg squat without hanging on. Feels like it's going to collapse on her. So when we go through and assess quads, glutes, hams, she is not good. Well, she's sedentary all the time because somebody a long time ago told her, you can't move around because you have scoliosis and you're going to tear up your back and have herniated discs and be paralyzed and whatever. So we're going to work on lower extremity strength. So I asked her about, well, when you went to the blue folder place, what did they do there for you? So here comes your VRBO. So website, eye contact with patients, smiling, one-on-one. We're certified in this. We care the most. We're best personal attention, blah, blah, blah. She said, well, every time I would come in and I would ride the bike for 8 minutes, and then I would get off and the therapist would come over and like do some manual therapy, something or other with me, then hook me up to the E-stim. And then the aide would come over and take me off of this. So 10 minutes on the E-stim. Then the aide would come over and take me off of the E-stim. And then they would stretch me out. And then they would put me on. And then they would put the piece of tape on me. Wow. That's fantastic. That's like 45 minutes of absolute garbage. So I said, so how'd that go? She goes, well, when I came back for my 3rd visit, they asked me how I was doing. I wasn't doing any better. So they switched the E-stim. They said, okay, well, let's do the dry needling. That'll fix it. So they switched dry needling out for the E-stim. and then they switched, I think it was foam rolling. Now lay on this roller and do that by yourself rather than me stretching you out. So they go from one garbage thought process to the next garbage thought process until somebody finally says, oh, that feels good. Now that's the magic phrase. Once somebody in these PT mills says, oh, that feels good, boom, that's what you stay with, because it's all about make them feel good, don't irritate anything, make sure when they leave they feel better than they felt when they came in, even though 1 to 12 hours later they're back to square one. So there's your VRBO thought process for conventional PT mills. Why are we settling for that? Why are we letting patients tell us what feels best and then that's what we do? That makes absolutely no sense.